significant or not. So depending on the exposure, we categorize exposures into 3 categories. Category 1, 2, and 3. Category 1 is inapparent exposure. That means touching or feeding animals on intact skin, right? General casual contact with the animal is category 1, right? Then category 2 and 3, 2 is minor exposure, 3 is major exposure, which was earlier we have this classification minor exposure and major exposure, but now we go by this category 1, category 2, category 3, right? Rather than minor and major exposure. So category 2 is nibbling of skin. Sometimes if you had pets at home, the dog at home, if you irritate them, sometimes try to bite you, but they take care not to actually hurt you. So the bite does not involve the entire skin and it won't bleed, but you will just see a mark there. So it abrades the superficial skin. It's not a transdermal bite, right? The superficial layers of the epidermis has been scratched. So anyone who had a dog and who had irritated a dog would know this, what it means, right? So it's called nibbling of the skin. There won't be bleed there, right? Just some superficial cells been disrupted. Then scratches and mild abrasion without bleed, something like that. So if that is bleeding, scratch with bleed, it goes under the category 2, right? Sorry, with bleed category 3, without bleeding goes on category 2, right? Category 3 is any bites on face, neck, genitalia, any bleeding wounds, right? And especially children, they go on to category 3 because children have a shorter distance to travel. Generally, we treat children as a major exposure. All right. So any transdermal bites, multiple bites, close to the face, close to the brain, all are considered category 3. Right. So important why you categorize, important of categorizing them is the treatment. For category 1, there is no treatment. Right. Because observe the animal, if there is any suspicion, you can initiate treatment later on. But generally, you don't have you don't need to treat the category 1 exposure. That means casual contact with the suspected rabies animal. Then if it is category 2, that means nibbling of skin, scratches, abrasion without bleeding, you give only the vaccine. Any exposure under category 3, then you have to give both vaccine and anti-rabies serum. Right? So both should be given together. Can someone tell why we give both ARS and ARV? If the exposure is major, can somebody give the reason?
Immunization and active immunization.
So why do you want to give it like that? Why do you want passive immunization in this situation?
Because in major exposure, there may be the virus in the wound, so giving anti-rabies serum, it will prevent the entering of this virus into the nervous system. Then given the vaccine for systemic protection for antibody production.
So why for some category 2 we give only ARV then? Why category 3 only we give both? And it's like this, right? So if this axis is this is antibody levels. Right? This is time. Right? So when you give ARV, the vaccine, antibody levels will gradually increase like that. Right? So the minimal antibody level that needs to be there for protection is somewhere there. Right? It where do you think it will occur? After routine vaccination program, after how many days will you get the protective level of antibodies? Any guess?
More.
How many days?
More than 7 to 10 days.
Yeah, around 14 days, right? So it's a routine vaccination program, right? You need about 14 days to get the antibody levels up to the protective level, right? So during this period, there is a risk of getting rabies, right? During this period, there is a risk of getting rabies. So in which cases are more likely to develop rabies in this period? What type of exposures? That means
Maybe.
low incubation period, right? That means the incubation period is less than 14 days, right? So in the exposures, the incubation period can be less than 14 days. There is increased risk of rabies occurring at that period, right? So what are the causes? Like bite to the face, bite on genitalia, bite on hands, multiple bites, multiple transdermal bites. In those cases, the incubation period is short. Totally, it can be up to 7 days, 8 days also, right? So in those cases, if you only apply the vaccination, right, ARV, what can happen? They can get the disease, right? Because by the time the ARV produces protective level antibodies, the disease is already established, right? So in those patients, we have to give ARS to cover the acute period. So when you give ARS, the antibody levels will start up from there and will come down gradually like that, right? Okay. So during this period, the ARS will cover, right? And when the ARS, the passively given antibodies start to wean off, ARV will take on and produce the antibodies, right? So when you suspect a particular exposure to a rabid animal will cause incubation period to be low, then you give both ARS and ARV. That is category 3, right? If you think the exposure is less significant, then you can go with only ARV. Another, right? So that is why we give ARS and ARV both to high exposure categories and only ARV in low exposure categories. Okay? Understood? Any questions about that? Another?
Yes, sir.
Yes, sir.
Now, where's my presentation now? On. Oh. What happened to the presentation? It's disappeared from the screen. Anyhow, okay, it's, the screen has gone. The PowerPoint has gone during that period. I got it. Hurry. Can you see it now?
Yes, sir.
PowerPoint pain now, huh?
Yes, sir.
PowerPoint pain now,
Yes, sir.
huh?
Now,
Can you see?
yes, sir.
Right, okay. Right, good. ඊළඟට අපි වෙන්නේ දැන්. You got the next slide you can see now. Can you see the next slide?
Yes, sir.
Yes, sir.
Right, okay. Right. Now, make up this can be best of MCQ, right? So the management will depending on the animal and cell. So earlier we said depending on the exposure, right? Depending on the treat, and again depending on the animal also, there will be management difference, right? So if the animal is not available, say පාරනකොට බල්ලෙක් කෑවා කියලා එලා කියනවා කියලා පාරේදී බල්ලෙක් කෑවා කාපු සත දාන්න ඉන්න කොහෙද කියලා දන්නේ නැහැ. So we don't know the whereabouts of the animal. In that situation, you initiate full ARS and ARV. You don't take chances, right? So if the bite is significant and animal is not found, you give the full treatment. If the animal is dead, in that situation, again, you initiate treatment, both ARS and ARV, and then you send the brain for the investigations, and the brain is positive, you continue with the full treatment. If the brain is negative, you can stop if it is not significant, right? Animal is live and low suspicion, maybe given 1 or 2 vaccines, and animal that was kept under lock and key in the house, not going all over the places, and can be observed. And it was a provoked bite. The mascot so the provoked bite. With the provoked bite, then low risk, then you can wait without initiating treatment and observe the animal for 14 days. And if the animal starts to provide symptoms, then you start a full course of treatment, right? So that's the one that you do if there is a very low exposure. If the animal is live and suspicious, initiate treatment and decide, say, it was not a provoked bite, unprovoked bite, and the animal has been unwell for past couple of days. And if you are not willing to kill the animal also, right, you can initiate full treatment and observe the animal. And depending on animal is live or not, by 14th day, we decide the treatment. Okay? So that is how we decide on animal. And other thing, common thing is that we'll come to that later. Anything about it? Questions? Any question about that? Are you clear about this? Any questions about it? මේක හරියට දැනගන්න මොකද අරට මිනිස්සු අහනවා, right? This is a very big problem to many. I get so many telephone calls on relatives and friends about what to do in animal bites, right? And not only from friends, but doctors as well, so students and even some of my colleagues, because people are very not gray about it, not clear what to do, right? So learn it properly, because we will need this, right? The people coming and asking for advice on this. So depending on the animal's condition, right? So if we go through it again, if animal is not available, initiate full treatment. If animal is dead, initiate full treatment, and depending on the post-mortem findings, decide to continue or stop it. If animal is low risk and the provoked bite, partially vaccinated, observable, to observe the animal and initiate treatment if the animal develops symptoms, right? If animal is suspicious, unprovoked bite, to initiate treatment and observe the animal. And if animal is living, we can stop the treatment after 14 days, right? So that is the management according to the condition of the animal. Is it clear? Any questions about?
Sir, I have a question, sir.
Yeah.
Sir, if the animal is not available and the exposure is low, do we continue treatment? Like if he just leaked or just scratched on the surface, do we continue treatment?
No, then you have to go ARV only. If the animal is not available, but it's under category 1, category 2,
Yeah.
then ARV only.
Okay,
right?
sir. Okay.
So the both are, as I said, both. So I will say two things, no? One thing is the category, second thing is the animal. So combine both. So if the category 2 bite, you give only the ARV, right? Okay.
Okay, sir. Okay, sir. Okay.
Any question? Any other questions? Right. So, sorry. Yeah.
So does that mean if the animal is if that category 2 bite, but the animal is not found, only the ARV?
Yeah, ARV. So ARV, but if it's a transdermal bite or transdermal scratch, a bleeding, then you go for both ARS and ARV, right?
Okay.
So you consider both factors, the category of bite as well as the state of the animal, right?
Okay, thank you.
So, yeah.
So if the ARV has been given previously and this is like the second bite, in that case, what do we do?
We come to that later, right? We come to that. We are discussing it in the later slides, right? So, any other questions about that? Right. So we'll use ARS, right? ARS is anti-rabies serum. Now there are two types of anti-rabies serum, right? One type is equine. Equine where you inject the virus to horses and get serum from the horse and extract the anti-rabies antibodies from the blood. That is called equine ARS. And you can have human one as well, right? So human ARS, right? So both can be used. And generally you give it within 72 hours of the exposure, right? So the effects are more if you give it within 72 hours of exposure, but you can give it at any time, right? So even if child comes around persons, but they didn't think it is rabies and but still you can give it. That's why giving it because it will be less effective, but you tell that to parents, otherwise they lose faith in our system. But tell it's less, might be less effective, but still you can give it, right? You can give it at any time, right? But better given within 72 hours, right? ගොඩක් වෙලාවට වෙන්නේ බල පෙටව කාලා දැන් ඔය දෙකක් වුණා ලංකාවේ මේ මාසෙ ලිපිස් දෙකක් වුණා එකම බල පෙටව කාලා. හරිද? It is bites by puppies are more dangerous than bites by adults, right? Because these puppies are a bit of always nibbling at people, and then there is evidence that it is virus is transmitted transplacentally. If the mother dog, the bitch has virus, it can transmit to the puppies transplacentally, and generally the puppies are not vaccinated about 3 months of age. They are first dose given around 3 months of age. So the young puppies are generally not vaccinated and they can get it even if the bite because it can be transmitted transplacentally. So these bites by puppies are more dangerous. So don't ignore a bite by a puppy, right? And bite by a cat as I told earlier, right? So don't expect a very furious dog to come and bite or to get rabies, right? So most of the cases of rabies have been actually unsuspected bites, right? So other thing is if you start, say you get a low exposure bite, and then you think it's a low exposure bite, right? Category 2, and you start ARV, and 2 days later they come and say dog bite. Then what do you do? Again, you give ARS. You give ARS at that particular moment and continue the same course of ARV. You don't have to restart the ARV again, right? That's the important thing. Common waste of fire, correct? So if you already started the ARV program and you decide to give ARS between middle of the ARV program, you can still give ARS, right? And you can continue with the rest of the ARV as it was given earlier. You don't have to start it again from the beginning. This will not have, right? So you have started the ARV program and then already given, say you guys already given 2 doses of ARV, and then you decide you need ARS also. You can give ARS and continue with the rest of the course. Is it clear? Right. So the main difference between equine and human is that equine dose is different, right? For human, you need only 20 units per kg, whereas for equine, you need 40 units per kg because human one is more effective. You need half the dose of equine, right? And for the human one, you don't need to do a sensitivity test. But for equine ARS, you have to do a sensitivity test. And if sensitivity is positive, you can't give the equine one, right? For human one, you don't have to do a sensitivity test, right? ST is done same as you do ST for the penicillin. After reaction, flare reaction after injecting intradermally. But for ARS of human origin, you don't have to do it. Right? So you calculate the dose of the ARS and then you give as much as possible to the surrounding area of the wound. depending on the site. ඇඟිල්ල වගේ නම් ගොඩක් ගහන්න බෑනේ. පොඩ්ඩක් ගහන්න වෙන්නේ. But මෙතන වගේ කාලා නම් ගොඩක් ගහන්න පුළුවන්. So you try to infiltrate around the wound as much as possible. Right? And you concentrate more at the proximal end of the wound. මෙතන කාලා නම් මෙතන කාලා නම් you try to give it more at the proximal side. Right? Concentrate on proximal side. And you think why? Why you give more at proximal side?
Because the virus will travel in that direction.
Yeah, good. Yeah, because the virus going in that direction. So we have to have the antibodies more in that direction, right? So you give the maximum amount. So dose එකෙන් පුළුවන් තරම් ප්‍රමාණයක් දෙනවා wound එක වටේට. දීලා ඉතුරු ප්‍රමාණය දෙනවනේ. ඉතුරු ප්‍රමාණය IM ගන්නවා. Right? So the rest of the dose that you can't infiltrate around the wound, you give it deep IM. Right? And you initiate the ARV program on the same day. So day not first day you give the ARS and ARV. So if you've given it from this limb, you'll give it ARV to the other limb. Don't give it same limb because the chance of neutralizing the ARV by ARS is high if you give same limb, right? So use a different limb for vaccination. So ARV also given deep IM, right? So that's what how ARS is given. So shown here, right? Issue is if you get a positive ARS equine. So most of the time what you have in the hospitals are equine one. Human one is very expensive, right? Human ARS is very expensive, not freely available. Most of the hospital does not have a human ARS, right? So most of the hospital, even Ragam, we have equine ARS. If you want human ARS, we have to local purchase it and expensive, and you have to give right lot of forms. If you want to give, you have to justify giving ARS if you are giving it. Because once I gave a human ARS and I had to write several letters justifying why I give ARS, human ARS. It's very expensive, right? So if the ST is positive, then options you have is to give it with the human ARS, right? But then if you don't have human ARS, right? Don't have human ARS, what to do? In that situation, if the animal can be observed, even it's a major category bite, category 3 bite, even the animal can be observed, you can give intradermal ARV, right? This one, right? Because when you give a vaccine intradermally, it's going to be more immunogenic than any other route because intradermally you have the dendritic cells in the skin, so they will act as antigen presenting cells. So the immunogenicity is high, right? So instead of giving IM, you can give intradermal ARV if the patient is sensitive to the equine ARS, and you can't give human ARS because it's available and the animal is observable, right? If the animal is not exhaustable, if the animal has died and very suspicious bite, definite rabbit bite, in that situation, you can't take chances, right? So, and if you are not having ARS of human origin and you're not get it from anywhere also, then you have to give equine ARS under adrenaline and antihistamine cover in ICU setup, ready to intubate, right? But don't give steroids, right? Don't give steroids because if you give steroids, it will propagate it will increase the chance of viral propagation. That means if you give steroids, then the risk of having rabies is high, right? So steroids are not given routinely to prevent anaphylaxis or reaction. That if child develops anaphylaxis, then you might have to give it. That's a different story, right? But to prevent anaphylaxis or to prevent an allergic reaction, we don't give steroids, right? So are we clear about it? So if a patient is allergic, is sensitive, is positive for equine ARS, and if we have human ARS, we go for human ARS. If patient is having reaction to equine ARS and the animal is observable and the risk is not extensive, instead of giving ARS, we can give intradermal ARV. But if the animal bite is very suspicious, and we don't have human ARS. We have to give it under ICU cover with adrenaline cover and histamine. So it's you are giving adrenaline as prophylactic, not as to treat. Any difference between you treating anaphylaxis and prophylactic adrenaline? Any idea? So if you are managing an anaphylaxis, you give an adrenaline. Here we are not going to manage an anaphylaxis, we are going to prevent an anaphylaxis. එතනදී වෙනස මොකක්ද නිල්තන විදිහේ? How do you adrenaline if you want to prevent an anaphylaxis? Route of administration. If you are treating an anaphylaxis, how you give it? If a child has anaphylaxis and if you want to treat the anaphylaxis, what the route we use?
IM.
IM, yeah, IM, because we want a rapid absorption in the situation, right? So IM. So if you want to prevent anaphylaxis,
Subcutaneous.
good, subcutaneous. That's the difference, right? Because you want to have a slow, sustained level of adrenaline, which will be more with the subcut, right? So if in this situation, you get the subcut adrenaline and in a ICU setup. Parallel, they clear the notes about it. It's all MCQs, best of 5 MCQs, right? So be aware about it. Clear, Nane? Right, okay. Any questions? Right, we'll move on then. So what about suturing? Sometimes these bites can be severe and open wounds with a lot of bleeding, right? And then you might need suturing, right? Be careful of this situation. About a couple of years ago, there's a case in LRH where there's a large lacerated wound by dog bite. The ward doctor sent the patient to theatre for wound management without telling that it was a suspected rabbit dog bite, and then they sutured the wound without giving ARS, and the patient developed rabies and died, and there's a court case against them doctors also, right? So be careful. You don't suture animal bites. There is suspicion of rabies, right? If there is a need for suture, then you have to infiltrate the wound with ARS before suturing. That is important thing. Don't forget this, right? In a house officers also, you get so many bites like that for surgical house officer, right? If you get a laceration, even with major bleed, if there is necessity for urgent suturing, especially for stopping the bleeding, right? Main indication to go for acute suturing is stop bleeding, arrest bleeding. So if you need suturing immediately, make sure you are infiltrated the wound with ARS before initiating suturing. And that's why we said earlier also, when you're transporting a patient with animal bite, don't apply occlusive dressing. That means tight dressings over the wound, right? If you apply tight dressings over a wound, then it increases the chance of having clinical rabies, right? Yeah, the current golden rules, right? And then about ARV, we have different types of ARV vaccine, right? It is always a killed vaccine. You don't give live attenuated vaccines for rabies because if they get activation, you are in trouble, right? So we don't take chances with live attenuated vaccines. For animals and humans, both we give killed vaccine, right? Killed vaccine. And good old days, about maybe 30, 40 years ago, what the vaccine used was goat brain vaccine. Goat brain vaccine where the virus was grown in goat brain and then extracted, and the extracts were injected to the patient. So that's why those are the ones that actually saying all about them. Buriye vate injection විසිකක් ඔයගොල්ලෝ කියනවා දවසට. බල්ලෙක් කාලා ගියාම අහලා ආච්චිලි සියල ඉන්නවලන්ගේ අහලා බලන්න කොහොමද බල්ලෙක්ව මැනේජ් කරේ කියලා බුරිය වටේ 21ක් වේත් විද්දා කියලා කියනවා. That was the goat brain vaccine, right? And then this, because of the goat brain vaccine contained the nerve tissue in it, nerve antigens. A lot of patients who had the goat brain vaccine developed neurological complications like Guillain-Barré syndrome, SNE myelitis, transverse myelitis, right? So the goat brain vaccine went out of favor, and at the moment, nowhere in the world goat brain vaccine is used. The WHO has prohibited using goat brain vaccine because of the neurological complications, right? So what they use in clinical setup now are the 3 vaccines. One thing, avian or duck embryo vaccine developed in bird embryos. Then virocell vaccine. Viro can കാണുന്നത്? Who is virocell? Raga cell. Which cell line? Virocells? Monkey kidney, right? Monkey kidney cells. These are all cell culture vaccines. Monkey kidney cells, right? Virocell vaccine and human deployed, right? So that is a recombinant vaccination. Recombinant vaccine produced by recombination DNA recombination technique. So these are 3 vaccines available. Lanka hospital. Which one do you think you have in the hospital? Which one do you have in the hospitals? What are the things that we are giving in Ragam hospital? What we have? Human can have, right? Very expensive. Human is very expensive. You can get it from private sector. If you're allergic or having a history of anaphylaxis or something like that, then you can go for human. But by private sector, it's expensive. Commonly we have is avian, the duck embryo vaccine we have. Some centers we have virocell vaccine, right? So that's also remember, if you have allergic history, you might have to get it from outside. And where to give it? You give it to a different site from the ARS. If you go it right hand for the ARS, if you left hand ARV, it is given deep IM, right? In an old child, you can give it to deltoid, 0.5 ml deltoid or anteroretal tie in a child under 5 years, because you don't have enough muscle mass in the deltoid in a child under 5 years. When you give it to deltoid, they get reaction there. So when you give it to deltoid, the anteroretal thigh of the leg in a child, but never give it to the buttocks, right? Buttocks should be avoided for vaccinations. Can somebody tell why? Vaccinations, we generally avoid buttocks. What's the reason? Can anybody think of reason why buttocks are avoided?
Risk of damaging the sciatic nerve.
But you can do it if you use the upper outer quadrant, there's no risk, no? So if you proper technique, there's no risk of damaging sciatic nerve. For vaccines, why? For vaccines, we don't use the buttocks. What's the reason? One reason you said is right, because that can be the risk of sciatic nerve damage if it is given by an inexperienced person, right? So midwife, then better to go for a different site. But when it comes to vaccines, why is avoided? Because the gluteal region contains a lot of fat tissue, right? Gluteal muscle, that area has a lot of fat tissue and less vascular compared to other sites. So the immunogenicity is less when you give vaccines to a buttock, right? So immunogenicity is low. So you avoid buttocks for vaccinations overall in any vaccine program, right? Buttocks are not a common, not a site used for vaccines, right? But in situation where you want a rapid response, you can give it intradermally instead of IM, right? When a vaccine given intradermally, it is more immunogenic, I told earlier also, right? So you can use these different regimes are available for intradermal regimes, right? What are given here is for the IM regime. So intradermal 2-site regimes, you can go give 2 sites at the same time, day 1, day 0, 2 sites, right? Intradermally. That is again to save the vaccine, because the dose is less when you give intradermally, right? So you can give intradermally, and you give intradermally is immunogenically more active as well, but then more vaccines to be given to child, right? So that's a disadvantage when you give intradermally. So more than 1 dose should be given. So you give the first dose on day 1, day 0. That 0 means the first day, and second dose on day 3, day 7, day 14, and day 28. And if the animal is alive by 14th day, then you can omit the day 28 dose. Right? So that's the regime. 5 doses given. 6 dose can be avoided if the animal is still living by 14 days, because then the chance of animal having rabies is minimal. Right? And then comes the pre-exposed prophylaxis. That means people who are having high risk of catching rabies or the occupation, like veterinary surgeons, the laboratory workers who are producing vaccines, right? And workers who are exposed to carcasses of animals, like wildlife officials, they have a high risk of catching rabies. For those people, even before exposure, we can give rabies vaccine, like we give for other vaccines like hepatitis B, rubella, MMR, like we give it before the exposure. We can give to them at 1 dose at day 1, the day not, and then 2 more doses. 2 doses to given afterwards. So this is for the pre-exposure prophylaxis, but not routinely given to general population, right? Pre-exposure prophylaxis not given routinely to general population, given only for the high-risk populations only, right? And this is the answer for the question you asked earlier. If a child already had a course of vaccination before, within 5 years of age, within last 5 years, if a child has had the ARV, full course of ARV, and bitten by a dog again, then you don't need ARS. You give only 2 doses of ARV at day 0 and day 3. So that is again a best of 5 MCQ, right? But if the last dose was given 5 years ago, then you manage it as a normal unvaccinated child, right? So if රොඩක්කට බබාගේ බල්ලගේ මේ vaccine record එක අරගෙන එනවා පෙන්නන්න. So a dog to be considered protected only after given 2 doses of vaccine. Single dose won't be effective, and always the last dose should be within 1 year of the bite. The last dose එක අවුරුදු දෙකකට කලින් ඉඳලා තිබ්බොත් that means that dog is at risk, right? So if they bring the record of immunization of the dog, check whether at least 2 doses were given, and the last dose was given within 1 year of the exposure, right? That's why puppies are dangerous, because puppies are not given the vaccine, right? And the thing is cats. ලංකාවේ පූසන ගන්න නැහැ ඉන්ජෙක්ෂන් එක. පූස අරන් ගන්න MOH එකෙන් පූසක මොකද? ඒක නම පිස්සු බෝල එන්න තියෙනවා. පිස්සු බෝල එන්න පූසන ගන්න බෑ කියලා ගන්න තමයි. Right? That's the problem. What about rat bites? හරියට ගන්න එකක් තමයි මේ මීයෝ කාලා එනවා. විතර මීයෝ කාලා. මොකද කරන්නේ? මීයා ශීරපායෙක්. Domestic rats, very common. In a GP, they come to you as well, right? What do you do?
No treatment.
No treatment, yeah, good. For domestic rats, no recommended treatment for rabies, because the risk is minimal, because they don't go outside. Right? But urumia is very dangerous one, right? Urumia bandicoots, they are very dangerous. Don't if you get a urumia bite, you have to always urumia hotambua aniddenna mugatia, right? Urumia hotamba mugatia are the other paradomestic animals which are not actually reared in houses, but you can find around the garden, right? Those are the animals which are dangerous to catch rabies. And Dandulena also a culprit, right? Because they go in and out from house and jungle, right? They can be eaten by a rabid animal in the jungle, and you can bite you as well. So those are the ones. So the golden rule is the rabies is not a curable disease. So if you have a doubt, always get a second opinion, right? So if there are any doubt about whether what treatment to given, or whether to stop treatment or initiate treatment, if you are in doubt, always get a second opinion, because if the child gets it, then there's no treatment and you are in trouble as well. If they have come to you and you have said no need of treatment and child develop rabies, then you will be in trouble, right? So that's it, I think. Any questions you want to ask?
Sir, about the suturing, if there's a there's a bleeding, higher bleeding in the after bite, so still suturing, putting oppressive dressing is also considered.
Now you have to decide what is more dangerous, right? If child is going to bleed to death because of the wound, you might have put occlusive dressing in that situation, right? So it will depend on situation. Child is a massive bleeding, and after bleed now again, then it's a problem. No? It's all depend on someone animal biting. Bleed good. So if the bleeding is more dangerous, then you might go at least put a occlusive dressing. If you are in case you are suturing, like you can put a loose suture until you give the ARS. You can without tight suturing, you can apply loose sutures until you get the ARS in and go second suturing later on. Right?
Okay, so thank
Any other questions?
Excuse me, sir.
Yeah.
In situations with multiple bites, and if the AR is for maximum dose is also not sufficient, can we dilute it?
No. You give as much as possible. To divide the dose and give it to sites as much as possible. Don't dilute it.
Okay, sir. Thank you.
To give it as much as so you have got 5 wounds. So decide how much you can give to each site and give it. Don't dilute it, right? Any other questions? Right. So in absence of, please stop it there, right? Okay. And I got to do 2 more lectures for you in the reproductive model, I think. One thing on the physiology changes at birth, abnormal puberty and neonatal resuscitation. Then,
Yes.
when can I do it? Or what time convenient for you? Tomorrow this time?
Sir, can I may I check? Can tell you, sir?
Okay, give me my number.
Yes, sir.
Give me a ring then. Check, discuss it with colleagues and let me know, right?
Okay.
I am free. It's better do in the evening. Zoom is better because less demand on Zoom now. The Alvari Karapam would have interrupt, disturb, Okay, then, right.
Thank you, sir.
Okay, we'll stop it there. Okay.
Thank you, sir.
Okay.
Thank you, sir.
Thank you, sir.
Thank you, sir.
Okay, welcome.